So I had a heart ultrasound done last week and I got the results yesterday from my family doctor for now. Two things of note from the ultrasound is that my aortic root is borderline dilated at 38 millimeters and my ascending aorta is borderline dilated at 37 millimeters. This can be related to high blood pressure, which is something that I have. And then there are a lot of other reasons why this happens for some people. My doctor didn't seem too concerned and said that we would definitely follow up with another ultrasound in a year. Next week I have a stress test, and so I'll be able to talk to a cardiologist. I don't know if it'll be the same cardiologist that I've talked to before, but I will be able to talk to a cardiologist when I get the stress test. I'm looking forward to that because I will be able to look at these results with the cardiologist and talk to that person face to face about what all of this means coming from a specialist. I mentioned in an earlier video when I talked about going to the menopause clinic that she wanted to wait until I do the stress test and see the cardiologist and find out if the cardiologist thinks that I have coronary artery disease, because if I do, then I probably won't be able to do HRT. If I don't and he clears me, then I will be able to start HRT. So that is definitely something that I need to find out. I'm trying not to get too worked up about any of this until I talk to the cardiologist and get solid information from their end of things as far as what they think, and then we can go from there. A lot of the health and medical stuff that I've been navigating for the last year or two typically happen to individuals who are really unhealthy. Like, they're not exercising, they're not active, they are sedentary, they're smoking, they're drinking, they are obese, things like that. And that is not the case for me. None of those things apply for me. So that tells me that some of this could be genetic or just kind of individual to me, like maybe I'm special. So I'm anxious to go for the stress test next week and see what that brings and talk to the cardiologist so that I can find out more information and be better informed and figure out where we can go from here. Because this whole journey for me is kind of like a full circle moment as far as like everything interacts with each other. So I am in perimenopause. I'd like to take HRT if I can. I can't take HRT until I get the cardiologist's okay, because I have been having chest pain and issues with my chest for the past 4 or 5 months, and so it's like everything is just kind of intertwined with each other, and so it's kind of like I'm playing the long game. So I will definitely update you guys on this part of things after I get the stress test and talk to the cardiologist.